Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech. And today I have Christina from Quartet with us. Really looking forward to our conversation. Before we get started, Christina, could you offer some background about yourself and then Quartet Health as well?
Sure. Good afternoon, Solomay. Thanks for having me on. My name is Christina Mainelli. I'm the President and Chief Operating Officer at Quartet Health. Just a bit about myself before we talk about Quartet and behavioral healthcare. I've spent over 2 decades in the healthcare industry. I've held leadership roles in public and privately held companies. I've also worked in the payer space, the provider space, and at healthcare tech companies. I feel very fortunate to have worked in physical healthcare and behavioral healthcare and in social care. So kind of what I call the 3 legs of the stool. And I'm a big believer in whole person health. But really my true passion, it lies in mental health care, and for a couple of reasons. First of all, just because of the sheer number of individuals that have mental health challenges. And, we've seen through the pandemic how the numbers are skyrocketing. And second of all, quite frankly, I have a number of friends and family members that have mental health issues, whether it be mental health, substance use. And I really feel committed to helping to solve these challenges and help have a better integration of physical and mental health care.
Thanks so much. And without further ado, for those who are unfamiliar, can you talk about Quartet Health and your approach to behavioral health?
Sure. So Quartet Health is a technology and services company. It works with health plans, health systems, and providers to help deliver speed to quality behavioral health care. Sounds simple, may sound easy, but actually it's really not. Our foundation is our ability to connect a patient from a primary care physician's office to a mental health provider. And the way we do that is through our technology platform. And second, there's been a few innovations over the past few years at Quartet Health. We have launched a first of its kind value-based care program, which I'd love to tell you more about. And second, we have expanded our capabilities and moved into the delivery of care. So not only do we connect patients from primary care to mental health care, we offer value-based care services for providers. We also are delivering care for certain populations.
Okay, definitely want to dig into that more. But you mentioned whole person care, physical and behavioral health a couple times. Can you talk about why that intersection is important?
Sure. I can talk about why it's important. I'll also talk about kind of our approach to it at Quartet. So, when I was working in physical healthcare, there are many situations when there are individuals that have a physical health condition with an underlying mental health condition. And it is oftentimes very difficult to address the physical health condition without addressing the underlying mental health condition. So we call these comorbid situations in healthcare, as I'm sure you know. And we feel at Quartet Health that it's very important to provide an integrated approach to care. So therefore, Quartet was founded 7 years ago under the premise of we are going to connect a patient from primary care to mental health care, which 7 years ago was a pretty innovative idea. We are still working on that as a system today. Therefore, so with our platform, we call it kind of a front door. Any patient can get access to mental health care through Quartet's front door. Once they go through the front door, and this is a technical front door that is facilitated by the primary care physician, we have analytics, and the analytics help to match the patient to the best provider. So when we say match, what do we mean? So this could be information about acuity level, diagnosis, patient preference, and that could be virtual or in person. It could be language, it could be race. And so we are matching with analytics the patient to the best mental health provider. And then we perform follow-up to ensure that that visit happened. And so we're really closing the loop there between physical and mental health care. Now, we also address this through a few different ways. You asked about our approach to behavioral health care. we have our front door and our analytics. We also, as I mentioned earlier, are able to provide care in some situations for some populations. And this is facilitated through our acquisition of Novotel Telepsychiatry, which is pretty recent news. We closed that deal in December. So we're about 5 months in, and we're really thrilled about the opportunities and the possibilities to continue to provide care through Novotel, which is licensed in 50 states, sees patients in 33, and has a specialty in the moderate to seriously mentally ill.
That is exciting. Would love to hear more about what's your vision for the combined company moving forward.
Sure. Well, we are very happy to be able to take our front door, match patients to care, and we work with, on the supply side, we work with either in-network providers that work with health plans. We may work with other care partners, we call them, or national virtual telehealth providers, because we believe that to solve all the challenges with supply and behavioral health, we really need to partner with all. And the third solution is through providing care directly. So our plan is that when a patient comes through our front door, when it's matched to a provider, if we in fact have the best provider for that patient, a Novotel Medical or a Novotel Telepsychiatry will service that patient. And, you know, we have plans to really launch this as a full virtual clinic in which we will see patients throughout their entire care journey and have a multidisciplinary care team as well as a psychiatry-led model to help ensure we've got the best quality and outcomes.
That's really exciting, Christina. And, you know, that idea of getting the patient to the right provider is so important for so many reasons. You're talking about the severity level of their issues, cultural sensitivity of the provider. That's really exciting to hear, because today that is still such a huge problem. And so I'm excited to learn of that. But can I ask you more broadly, you know, what is the role of digital tools in expanding access to integrated behavioral health?
Sure. That is a fascinating topic. As you know, the pandemic fundamentally shifted our industry, many industries, but in particular, healthcare, and I would say mental health care. You know, there's a report that I saw by Rock Health in Q1 of this year, over $1 billion was invested in mental health startups. That's a big number. And what's great about this is a lot of these companies are virtual providers of care, and that could be digital tools, virtual care providers. And there's a lot of positives that come from this. So first of all, we've had a lot of innovation and telehealth regulations, which allow telehealth to be accessed and used and reimbursed, very importantly, for patients and providers. And that kind of frees up supply. And also this has helped with adoption. You know, 3-4 years ago, it was pretty hard to get people to use virtual telebehavioral health appointments. Not so much today. The other thing that I believe about digital tools is that, yes, they increase access because it's another form of supply. In many cases, they are targeting a specific segment of the population or a specific diagnosis. So, for example, there are a number of tools. In fact, there are many tools targeted at employers, and I would say the worried well. So these are tools that help folks that maybe aren't moderate or severely mentally ill to get access to some form of care. And also, there is supply that remains to assist some of the more moderate or high acuity patients. So these are all very good things, I think. You know, from a virtual care delivery perspective, what we have found is that through our acquisition of Novotel, we can see seriously mentally ill patients virtually, which may be something that was challenged or questioned 3, 4, 5 years ago. That said, Novotel has been doing it for 7 years. So they were founded as a virtual telepsychiatry model, which I think is fascinating. And they continue to do so. So they're very skilled at it, clinically very excellent and strong, high quality care, and they're digital or virtual.
Yes, it's without stating the obvious, silver lining coming out of the pandemic is that, yeah, we know these things are working, and now how can we continue that momentum? You've mentioned value-based care a few times, and it's exciting to see this work you're doing because so much of behavioral health, of course, is still fee-for-service. Can you talk a little bit more about it and how that plays a role in Quartet's offerings on the market?
Sure. And you may know, behavioral health care in many ways is not as advanced as physical health care when it comes to the move towards quality and value. And some of this is because it's diagnoses in behavioral health are a little bit, I would say, more challenging than physical health. You can't take a blood test, for example, to get a behavioral health diagnosis, and in many cases, where you can do that on the physical side of healthcare. That said, there's also, I think, not a clear definition of value or quality in behavioral health care. So at Quartet, what we decided to do is work with our payer customers to define value, and then to set up measures around value and to work with providers and networks to help to bring them toward value. So really, this is a win-win-win in my mind. And so through our program, we are able to help move a provider network toward value on behalf of a payer and on behalf of their members or the provider's patients. And the way we do this is by defining what is quality, what are the quality measures that we're going to track. We provide technology and services to help to measure and monitor the movement towards value. We report back to the providers to let them know how they're doing. And then when in fact they are performing to the definition of value, which I can talk about in a moment, they receive bonus payments. So that's the win for them too. And value-based care can be defined in a couple of different ways. So some of the measures are more, I would say, activity-based. So did you complete a PHQ-2? Did you complete a PHQ-9? Was there a follow-up after hospitalization? All the way towards outcome measures. So have you impacted this patient's outcome and the total cost of care outcome, which is really where we're all trying to go. Is the patient better? Is the patient doing well? Are we achieving better outcomes through this program?
And maybe we could talk a little bit about results then. This isn't easy to do, and to be successful in value-based care, of course, you need to have great outcomes, as you mentioned. So how do you go about measuring those outcomes? What benefits have you already seen so far with Quartet's approach?
Sure. So there's a couple different lenses to that response. So for Quartet Health, for our core platform, we measure quality by using assessments. So we talked about the PHQ-2 or the PHQ-9, and this is asking patients, essentially, if you're not familiar with it, how are they feeling? Are the responses to their questions progressing in a positive manner? So we are able to track that off our core platform. And when we are able to do that and partnering with payers, we see a 5 to 10% reduction in total medical costs for individuals who engage in care via Quartet. And a lot of that's due to getting speed to care and having them engaged in care. Now, with value-based care, our program is fairly new. It's live in 13 states, but we don't have our outcome-based results yet. What I can say is we are getting very positive feedback, not only from the payer, but from the providers. So that's really important because we are bringing them along in the journey, which is absolutely critical in healthcare on any journey that you're bringing the system along. When we talk about outcomes with Novotel, really we'll be looking at outcomes with respect to not only the quality of the providers, are we performing person-centered care, are we practicing measurement-based care, but then also the measurement of outcomes for the seriously mentally ill patient population that we'll be treating.
And you bring up such a good point around having providers engaged too. So that's really impressive to make this much progress with all of the stakeholders you've talked about. Well, how are we already running out of time? I think if I could sneak in one more question, if I could ask you, Christina, what do you think is the biggest change that you expect to see in behavioral health in the next 5 to 10 years or so? And what role will digital have in it?
It's a great question and one we could have spent the whole time on, right? Normally I would say that change in healthcare takes a long time. But what we've just seen with the pandemic is that an event can fundamentally change the industry almost overnight. So as we take our learnings from the pandemic and from what I know about healthcare and behavioral healthcare, I believe that there will be a mix of virtual and in-person care always, but really depending on acuity and patient preference. So for mild physical and mental health conditions, I imagine that could be fully tech enabled for patients that want it to be. You may not have to go into an office with remote monitoring, with virtual care, digital tools. You really can support many, many conditions if in fact that supports patient choice. Now for acute or specialty conditions, I think there likely still will be a hybrid model so that there will be a fair amount of virtual care. And then also the opportunity or the need in some cases to go in for treatment. For all patients, though, I believe there's going to be a lot more of a move to whole person care. So earlier on, we were talking about the integration of physical and mental health care. I argue that social care too, transportation, meals, and other types of services could be received all through one experience, and a personalized experience based on what the individual needs to meet their needs and preferences. And really this move towards whole person care, more personalized care, and specialized care for higher acuity levels is really a lot of what our strategy in moving into care delivery and acquiring Novotel was based on. So it's one step along that journey, but we really feel that it's important to connect patients to the right provider for them that's going to meet their needs and give them the best opportunity to get well and have better outcomes.
Christina, I want to ask just one more question because I think this is a really important issue and I want to make sure that we drive it home. Could you double click on quality again, especially as it relates to speed to care? Because as you know, a lot of people are struggling right now and we just frankly don't have time to waste to get them the help they need.
Yeah, I agree with you. And really, it comes back to sort of one of the core issues in behavioral health is access, right? There just simply isn't access to care. And that even comes before the question on quality. But let me talk a little bit about those two topics. So from an access perspective, speed to care is absolutely a measure. Many patients are waiting, and I'm sure you read about this or hear about personal stories, weeks, if not months, to get into care, even if they're seriously mentally ill. At Quartet, we are using speed to care as a measure of quality. And our goal is to get patients to care in less than 14 days for mild to moderate and hours, if not days, for the seriously mentally ill. So this is a bold goal. And I really think it is becoming the industry standard, though. But that is our goal. And the way that we can get to the hours and days is through delivery of care ourselves with a Novotel in our virtual clinic. When we talk about quality more broadly, though, really we're looking at that in behavioral health care as sort of, is the provider using evidence-based activities or evidence-based programs? So we will look at a clinical care model. What are the treatment offerings? What are the care models? What are the care team roles? How are they collaborating with physical health? We also look at crisis protocols. What are the practices to escalate to a higher level of care? We look at training of providers when it comes to looking at quality in behavioral health care partners or even our own providers. And finally, and most importantly, we look at clinical outcomes. Are there validated assessment tools, measurement-based care, where we can prove that the patient has improved and gotten better?
Those are really setting quite a few high bars for your standard of quality. So I'm really glad that you could answer that. It's really exciting and unique work, really. Haven't heard many talk about the speed to care, which is critically important. It's not just about having the resource available, but can we actually get folks to them as quickly as possible? And I couldn't thank you enough for your time and sharing the latest with Quartet. Christina, really appreciate it. Thanks so much for being here.